Well, welcome to the show, Dr. Braza. It's a pleasure to have you here.
Well, thank you. I'm very pleased to be here.
Well, good. I hear you recently moved to Brunswick County. Is that correct?
That is correct. My wife and I moved here from Atlanta, and we're starting a new job here at Summit Plastic Surgery and Dermatology.
Well, I'm curious, what brought you to Brunswick County?
Well, we decided that we were ready to move to get a nice, more laid-back lifestyle here in Wilmington, Brunswick County area, and we found this great opportunity to join the Summit Plastic Surgery and Dermatology, which is an excellent group that has plastic surgery, dermatology, and then now we'll have Mohs surgery, which is my specialty.
Well, let's talk a little bit about your background and your education. Let's start with your education. Where did you go to school?
Sure. I went to University of Georgia for college, and then Emory University for medical school.
Great school.
Yeah, thanks. And then I continued my residency at Emory for dermatology, and then I spent a year in Louisville, Kentucky, doing my fellowship training in Mohs surgery.
And we're going to talk a lot more about Mohs surgery
Sure.
here in a little bit, but still trying to get to know you a little bit. How long have you been in practice?
About 10 years.
About 10 years.
Yeah.
All in Atlanta?
All in Atlanta.
Oh.
So.
Well, coming here to this sun state, this sun belt, boy, I'm sure your specialty is going to come in handy.
Yeah, we'll probably be pretty busy. Lots of people get a lot of sun here at the beach.
That's for sure. What made you decide to join Summit Cosmetic and Plastic Surgery?
We just like the fact that it's a very unique practice in the sense that we'll be the only practice in the North Carolina and South Carolina eastern side that has plastic surgery, dermatology, and Mohs surgery. And so the practice encompasses all of that together, and we work as a team to really help treat patients.
Oh, that's nice. That's nice. Are there any other services offered there at Summit?
Well, it's a variety of things within all those. First of all, we have 3 offices. Our main one in Wilmington, one in Holly Ridge, and then, of course, the one here in Supply.
Where's Holly Ridge?
That's north of Wilmington, probably
Oh.
about 45 minutes, an hour north of Wilmington.
Now, I think that some of the offices may have like an esthetician and
Yeah,
things
so
like that.
so we have an esthetician at 2 of our offices, Wilmington and the Supply office, and her name's Jamie, and she's wonderful. And so she kind of helps with the lasers. We do laser hair removal, treat little veins for lasers, and then we do other like chemical peels and a lot of different cosmetic type procedures.
So, boy, it's really a full service.
It's kind of full service. We do
practice.
Botox, fillers, for like collagen type injections, and then from the dermatology standpoint, we do see all type of rashes, acne, and then I do specialize in the Mohs surgery, which is the skin cancer removal.
Wow, that's wonderful information. But today our focus is going to be on Mohs surgery. Now, I don't have a clue what that is. So I would love to learn about that. So what is Mohs?
Sure. Well, Mohs surgery is a way to remove skin cancers. It was named after Dr. Frederick Mohs, who was from Wisconsin. He was a general surgeon who developed the technique. And what it involves is people coming in the office. We do it under local anesthesia. Patients are wide awake for it. They come in, typically we treat basal cells and squamous cell carcinomas, which are the most common type of skin cancers. And they come in the office, we remove the cancer, and then while they wait, we actually have a lab in our office, and which the cancer tissue gets processed, and I'm the pathologist. So once the cancer is removed and processed in the lab, I look at it under a microscope on a glass slide and check to make sure the cancer's all gone, make sure all the margins are clear.
Right.
And it's all while the patient waits. So it's nice because the patient will know it's all gone that day, because if I do see some cancer left, like in one corner, then we go back to the patient, we take that one little piece of skin we need at that corner, process the tissue again, and I check again, and we keep doing that same process till we get the cancer.
Oh, so it's not maybe the first time.
It's not,
the first swipe.
it's not usually all the first. About half the time it's on the first try, other times it's 2 or 3 tries, or some go even longer than that.
Right.
But it's nice because we'll know it's gone. Mohs has the highest cure rate of 99% versus any other type of procedure. And it also saves normal skin. So let's say you have a cancer on your nose where you don't have much skin there.
Right.
You don't want to take a lot of skin. You want to take just the cancer with some clear margins.
I see what you're saying.
And because once the area is gone, it has to be sewed back up.
Yes.
to make it look good. Because
And
not
like
only do
the
we
ear, would that be a?
the ears a commonplace, eyelids,
Oh.
mostly on the face,
Wow.
lips, which are mainly where people get the cancers. But all those areas, you don't have much skin. You're on eyelids, you don't have much skin. Ears, you don't have much skin. So you want to save as much, because like I said, once the cancer is gone, we have to get it repaired, or they call it reconstructed, for everything to look good. So I always tell my patients, the goal is, let's remove the cancer, but the second goal is, let's make it look good. So cosmetically make it look good, months down the road.
Right. And so you said you're the pathologist.
Yeah, so I'm the pathologist.
In the lab, then you're the one who looks at it under the
That
microscope
is
and
correct.
determines. So
Yeah.
it kind of all happens at once, and there's none of that going home and waiting for 48 hours
Exactly.
or 3 days. To
Yeah, so it's
find
all
out.
done usually in a few hours. So we tend to finish everything in the morning, but it is, patients have to sit and wait. We usually recommend bring a book to read, or bring a friend to keep you company.
Right.
But they are awake for the procedure. They can eat ahead of time, and so we try to make it real laid back for them, make it a good experience.
It's like an
'cause
event.
it is like an event, but patients seem to be real pleased with it. And like I said, did it for about 10 years. I've done over about 7,000 cases.
Wow.
Yeah, so.
So from the beginning of your career, you began doing Mohs
That's correct.
right off the bat?
Yeah, right from my training, where I
see.
did my fellowship training in Louisville, Kentucky, I joined a practice in Atlanta and started doing Mohs.
Uh-huh. And again, the guy who invented this process, what was his name?
Frederick Mohs, Dr. Frederick Mohs.
And he's the one who came up with this procedure?
Yeah, he came up with a procedure. It was probably about 40, 50 years ago. It was a
Really?
while ago.
Uh-huh.
He was a general surgeon in University of Wisconsin, up in Madison, and he had just discovered this way to do this. And at first, no one thought it would work. But then he did multiple cases, tens of thousands of cases, and published his results. And people said, "Oh, this actually does work." And it shows, with a success rate of 99%. And there's
That's
no
amazing.
there's no other treatment that's going to give you a 99%
Really?
success rate.
I didn't realize that.
Yeah.
That's historical. And again, you said, what kind of skin cancers would this be most appropriate for?
Typically basal cell carcinomas and squamous cell carcinomas. And there are other rare type of skin cancers that we don't see much of that we can do it for. Not typically used for melanoma, though. Typically we'll treat melanoma a different way than the Mohs surgery.
Uh-huh. And the procedure takes a couple of hours, so the patient can expect to be there like all morning.
Yeah, pretty much all. We start not too early, but we start in the morning around 7:30 or 8, and the patients, most of them will typically be gone by noon or 1 at the
So
latest.
it's an outpatient procedure.
Outpatient procedure, wide awake for it. Most of them drive there themselves, drive home.
Oh, they can drive themselves home? Wow.
Yeah.
Well, let's talk about recovery time. What does that look like?
Sure. Well, once the cancer is removed, I look at I call a wound or a defect, the spot that was left there after cancer is removed, and we make a decision on what's the best way to get it sewed up so cosmetically gives a good result. And I typically sew up most of what I do. And sometimes, if it's real small, we let it just heal in by Mother Nature.
Yeah.
Sometimes you can just sew it up, just a few little stitches and be done. But a lot of times, like on the nose and ears and stuff, you have to do like either a flap or a skin graft. And the point of that is to really move normal skin around into the spot to keep a good shape and contour and function to the nose or the ear or wherever, or the lip, wherever we're working. And so typically we'll do the suturing, then we'll bandage them up and send them home. Now sometimes, if necessary, we have a plastic surgeon on board, Dr. Ed Riccardelli, and he may do the suturing because sometimes they're in areas that are tricky that we want done perfectly. Sometimes the cancers get larger than we anticipated, so we have him as a standby or ready to go if need be.
And that could be done right there in the office following the surgery?
Yeah, sometimes it's done a day or two later,
I see.
depending on where he is that day and where I am that day.
The
But it's
severity
okay.
of the
Yeah, exactly,
wound.
and it's okay to wait a day or two.
Sure.
But we try to get most of it done all in the same day.
I don't imagine there are, but could there be side effects of the Mohs surgery?
I mean, there's basic little things
Just
you get from any
typical.
type of procedure. You can get bleeding, rarely get infection. It can be sore afterwards, but surprisingly not too sore. You definitely get bruising, swelling. Those are normal things. Especially like you work in the face, you can get a fair amount of bruising.
Yes.
But bruising goes away. Yeah. And then typically we bring it back a week later to take stitches out and make sure it's healing up good. But recovery is pretty simple. I mean, they just go home. We ask them to take it easy for a few days. I always joke and tell them, don't go run a marathon.
Right.
You know, don't go swim, you know, in the ocean or anything for a few days. But just take it easy. You know, but a lot of people go back to work the next day.
Really?
They do have a bandage on though, so they can tell a good story. While they're at work, while they have a bandage. But you know, people tend to do fine, and then like I said, a week later we take stitches out, and then we just wait slowly over time for our cosmetic result, because it does take usually up to a year for your final result for scarring and everything. You know, it looks good at a few weeks, but it'll look better at 6 months. It'll look even better at a year. You know, a lot of times we do it, and it blends in so well you can barely even see the scar.
Wow, that's great information. I believe you're also a reconstructive surgeon. Is that correct?
Yeah.
And do you do all types of reconstructive procedures?
Well, the reconstruction I do is from the Mohs surgery.
It's from the Mohs.
Yeah, so I don't do any other major type surgeries. Dr. Ed Riccardelli would handle those.
Right.
And he does more like the face lifts and neck lifts and things like that. But the point of me being a reconstructive surgeon deals with repairing the wound from the Mohs surgery. And that's part of our training and our fellowship.
Is it? And let's talk a little bit about, now you just mentioned facelifts and things like that. What other kinds of reconstructive surgery might your partners at Summit do? Like trauma things, if they were in a car accident?
Yeah, he does some trauma, you know, scar revisions, you know, people who've had some old scars they don't like. And then, you know, we do focus a little more on the cosmetic side. So I know he does like tummy tucks and breast implants, breast lifts, you know, neck lifts, eyelid surgery, which we call a blepharoplasty. And, you know, people just call them nose jobs, but, you know, changing your nose and things like that. So, you know, so that's kind of the cosmetic side of the practice. We all do the, you know, the Botox and the fillers.
You do that also.
And the fillers are Juvederm and Radius. They used to call them collagen. They don't really use collagen anymore. But these are all these newer fillers that people really like.
Let's talk a little bit about your practice now. Are you going to be based mostly in Supply? Yeah,
so I'll be in Supply 3 days a week, and I'll be in Wilmington twice a week.
I see.
And our Supply office is open Monday through Thursday, you know, and we're staffed there every day, and I'll be there 3 of those days, Monday, Tuesday, and Thursday.
Monday, Tuesday, and Thursday. That sounds good. And if there are folks out there who would like to speak with you more about this or have a concern about something on their face, how might they get in touch with you?
Sure. They can definitely call the office.
And we'll put that number on our trailer at the bottom of the...
Excellent. So the number will be there. And then we also have a web page, and it's summitcosmeticsurgery.com.
Okay.
And that's our web page, which has all the information. And then from there, they can, you know, find the numbers and call. And we're training everyone to be able to explain things and tell patients about what to expect when they come for Mohs surgery and just what our whole practice offers.
Well, yes, because that's a new concept here locally in this county. I believe you're the first surgeon to provide that service. So, as I said, with the sun and, you know, the Sun Belt here, I think there'll be a great need for that. And it sounds like the easiest way to go and the most effective. Yeah,
it is. It's great. You know, and like I said, patients, you know, after it's all done and the sutures are out, they appreciate it. You know?
I'm sure.
And it is nice being the first one here. We'll introduce it to everyone. And we like to make it a good experience for them. Because whenever you hear skin cancer, you get worried.
Absolutely.
You know, the types we treat, basal cells and squamous cells, you know, are very treatable. You know, most of the ones we see are caught early. They're not melanoma, which are the more scary type of skin cancer. But, you know, we take care of them. We try to make it a great experience for them. And then we definitely emphasize sunscreen, hats,
Absolutely.
You know, clothing, so hopefully they'll avoid getting any more in the future.
Yeah, wow.
But unfortunately, being around the beach, lots of people get a lot of sun.
That's true. That's true. Well, we welcome you and your family here to Brunswick County. We're so happy to have you here.
Yeah, we're very excited about our move down here.
It was a pleasure to have you on the show today, and I hope that I don't have to see you in the office.
Yeah,
but
hopefully not.
But I do hope to see you again.
See you at the grocery store. So.
I hope I'll see you in the grocery store.
Yeah, that's the best place.
All right. Well, thanks again. It was
a
pleasure.
Sure, I appreciate it.
All right.